Hello, I'm Dr. Robert Hamus, a plastic surgeon and the inventor of the ideal implant. The idea for the ideal implant came from listening to my patients. I realized that women want a breast implant that combines the benefits of both saline and silicone gel implants without having to accept the well-known compromises associated with each of them. Over the years, our team has refined the implant design and manufacturing quality. We will soon complete our 10-year U.S. clinical trial with over 500 women. FDA and Health Canada approved the ideal implant in November 2014, and we began sales in September 2015. The ideal implant is a new technology, third type of breast implant. Compared to a saline implant, which is just a water balloon, the ideal implant has an internal structure that supports the edges to prevent wrinkling and supports the upper pole to prevent collapse when upright. This internal structure makes the ideal implant feel natural, with only saline inside for a woman's peace of mind. Compared to silicone gel implants, the ideal implant has a significantly lower risk of rupture and a lower risk of capsule contracture. There is no risk of silent rupture, so no need for the FDA-recommended MRI scans to detect rupture. With the ideal implant, a woman can simply look at her breasts and know that her implants are intact. Because the ideal implant has an internal structure, it is called a structured breast implant. It has a series of nested shells, 3 to 5 depending on the size, with 2 separate lumens or chambers. The inner lumen is filled through a valve on the back, and the outer lumen is filled through a valve on the front. Because there are 2 chambers, the implant won't go flat if one chamber deflates, so unlike a saline implant, a replacement can be scheduled electively. The internal structure supports the edge so it does not wrinkle, and supports the upper pole so it does not collapse when upright. In effect, the internal structure supports the shell of the ideal implant, the same way cross-linked silicone gel supports the shell of silicone gel implants. Compare the ideal implant to a silicone gel implant to see how the edges of the ideal implant stay smooth and the upper pole does not collapse when upright. In addition to providing support, the internal structure of the ideal implant controls movement of the saline, so it does not bounce. It behaves like a silicone gel implant. The edges of the ideal implant were designed to be low and fit close to the curve of the chest wall. The implant is tapered from the dome to the edges, so the ideal implant does not bulge out laterally toward the arm. Here you can compare the ideal implant at minimal fill volume to the Allergan Style 15 implant. And here you can compare the ideal implant at maximum fill volume to the Allergan Inspira SRF, SSF, and SCF implants. The time has come to ask yourself, why use silicone gel implants instead of ideal implants? On a tabletop, the ideal implant feels natural and very similar to the silicone gel implant. So you know that once implanted, any differences in feel will be imperceptible. The issue with silicone gel implants is that ruptures are silent, which concerns women. They don't know if their own implants are intact or ruptured without an MRI, and even that is not always accurate. Obviously, informed, health-conscious women want to know what is going on inside their body. The results of large randomized surveys of women, including surveys of registered nurses, women physicians, and even women plastic surgeons, confirm that women want to know if their silicone gel implants are ruptured. And if found to be ruptured, they want the implant removed, even if asymptomatic. Most people do not know that the cumulative rupture rates of silicone gel implants over 10 years are very high, 9 to 24% in the MRI cohort for primary augmentation. Bear in mind, this is FDA core study data for these implants. And what should women expect the rupture rates to be beyond 10 years? The ideal implant is the alternative to silicone gel that women want. Natural feel, only saline inside for peace of mind, no silent ruptures, and no FDA-recommended MRIs. The ideal implant is the first new type of breast implant in over 30 years. No longer does a woman have to choose between a saline implant for peace of mind and a silicone gel implant for natural feel. With the ideal implant, she can have the best of both, natural feel without silent rupture.